Welcome to my channel. Welcome back for those of my 26 subscribers. Welcome back. I'm sorry that it took me 8 months to make this video. And for anybody that's new here, welcome. Come on in. I'm going to be bringing in more content, nursing and non-nursing. So, as you can tell by the title of this video, and I will be looking down because I took some notes. Why and how I quit bedside nursing full time. And yeah, I'm leaning and I'm slouching because my posture is terrible. I'm new to YouTube and I just gotta work. So here we go. I'm gonna start out with the why. The demands and the shifts. Those are probably my two biggest things. When you first start nursing school, you know, they drill it in you how this is a great profession and blah, blah, blah. And if it's your passion, you'll never work a day in your life and all that good stuff. Well, I'm here to tell you lies, lies, lies. And again, this is on my personal opinion and my personal experience. Before I became a nurse, I worked in the emergency room as a registration clerk and as a unit clerk for probably 6 to 8 years before I actually became a nurse in the ER. You would think that me being exposed to the ER all that time and, you know, speaking with the docs and speaking with the nurses and seeing how stressed out they were and really seeing what they went through would make me, you know, second guess my choice of profession or anything like that. And it didn't. Like, I'm hard-headed. If you tell me go left, I'm gonna go right. If you tell me go right, I'm gonna go left. So although there were some nurses along the way who said, Mel, do you really want to go into nursing? How about radiology? How about respiratory? You know, they don't get paid that much more or less than us, and they don't have to deal with half the BS. Probably should have took their advice, okay? So again, the demands. Talking to your non-nursing friends, they're gonna be like, oh, you only work 312s. Yeah, I do. But when you work 312, 7P to 7A, and I haven't had to do that in a long time, but when you work 312, 7P to 7A, you need that extra day to sleep because you're a zombie. The day after that, you're probably not doing anything because you still feel dead to the world. And then you may have a day or two off, but honestly, you're probably tired of dealing with people at that point, so you don't even want to deal with that. So that's pretty much like my demands. Like, it's just a lot. You know, I mean, and it's demands from patients, it's demands from administration, it's demands from your coworkers. You know, that patient in room 1 doesn't care that your patient in room 2 is a STEMI. The patient in room 1 asked for a warm blanket 20 minutes ago. How dare you? And that's the culture. That is the attitude against nurses. Like, well, what were you doing that you were so busy that you couldn't get me that ginger ale with extra ice? Anywho, get off that soapbox. Shifts. Again, I've been very fortunate and lucky to not have to work night shift for very long. When I first started off as a nurse, I worked 7 p.m. to 7 a.m. and I worked 3 p.m. to 3 a.m. for probably 6 months, not even a year before I went to day shift. And a lot of that probably, you know, I'm sure had to do with the fact that I worked in the ER as a nurse where I had already worked as a registration clerk and as a unit clerk. So I'm sure that had something to do with it. So, you know, again, I was fortunate enough to work that 7 a.m. shift, that coveted 7 a.m. shift that people love. I miss the nights. I wish that I could take my night shift crew and my team on nights and bring them on days, and it would have been the perfect marriage. But realistically, it doesn't work that way. Day shift nurses are a different kind of animal. Night shift nurses are a different kind of animal. The clientele that comes to the ER during the day versus during the night is a different kind of animal. So the shifts are hard. And when when I started traveling and I got lucky enough to do mostly 7 a.m.s, I did have that one assignment where I was mid-shift 11 a.m. to 11 p.m. And when I say I hated it, first of all, it's mid-shift. If you know the ER, you know 11-8, 11p is on and popping. Like, and that's when the neighborhood wakes up. Regardless of what part of the world you live in, that's when the neighborhood wakes up. From Philly to Atlanta to the counties, they all wake up at 11 a.m. Okay, so if you want to go to here's a tip, hot tip from the ER nurse. You want to come to the ER and you don't want it to be too busy, come before 10 a.m. or come after 10 p.m. Anything in between, you're going to be waiting. So that's pretty much it on the shifts. They're 12-hour shifts. They're long. They're longer when you have people you don't even want to work with. They're longer than that when the doctor works up that, you know, acuity of 4, cough times 2 months, 30-year-old. Like, yeah, they're long nights. They're long days. So that's pretty much those are my thoughts on that. And two of the main factors why I've just done with full-time bedside nursing. My second thing that I have here is the abuse the abuse from the patients, the abuse from management, coworkers, administrators. You know, I have been very fortunate to not really experience too much abuse from patients. I have been able to talk a lot of people down, but I've worked with nurses on the same shift and seen a nurse get kicked across the hallway, punched in the face, spit at, hair pulled. Like, the amount of abuse that happens to nurses, and not only in the ER, but everywhere throughout the hospital, is ridiculous. And I don't know what's going to happen for that to change. But in the ER, I can honestly say that you work so closely with the docs there that they will be the first one. Sometimes they're the first ones at the bedside, like, all right, let's just, you know, chemically sedate them and let's figure this out. A lot of the times in the floor, you don't have that. You know, you don't even have a doc on the floor. You have to page the doc, and by then the nurse is already on the ground. You know, in the ER, you're never alone. You can just call out for help. Somebody's going to come. Whether it's a nurse, security, a tech, somebody is going to come. But you shouldn't have to go into work, like, saying a prayer, like, please don't let nobody, you know, do any harm to me today. Like, why? That should not be an expected part of your job. But unfortunately, it is. And then you go to these orientations and they're like, this isn't tolerated here. But then you go and you work and you realize, oh, but it is. So that's pretty much my abuse standpoint from, you know, patients to the nurse. And, you know, as far as administrators are concerned, the abuse is real there too. You can walk in at 7 a.m. and your ER can be holding the whole entire ER. You pick up 3 holding assignments and your last room is empty. Well, guess what? Now you just got that code. So when you go to give report and you say, oh, these meds weren't given because you were running a code, they really don't care. You will be reported and you will be questioned about who, what, when, where, why you couldn't do it. And no matter what you come up with, is never going to be good enough. So at this point, I'm just kind of like, I'm one person. I'm going to handle what I can. And you have to stick up for yourself. You know, in nursing school, they tell you you have to be an advocate for your patient. And then you become a real nurse, RN real nurse, and you have a little experience under your belt and you realize, who's my advocate? I don't have an advocate. You have to speak up for yourself and you have to advocate for yourself. And I feel like when new nurses ask me what's my number one advice, I tell them advocate for yourself. And when they don't, you know, 100% understand what I mean at that point, I just say, you need to stick up for yourself. So again, abuse from administrators, and then you have, you know, some charge nurses that will come in and help you and be on their hands and knees trying to put an IV in too. And you have others that are just like, you all right? After you've sent the patient up and you know I'm not all right. But that's the name of the game. Number 3. Shmoney. Per diem nurses make significantly more money than full-time nurses. Perfect example. I recently took a per diem job at a local ER, and their full-time rate, and I live right outside of Philadelphia, but this is pretty much a Philadelphia hospital. I feel like our pay here in the city is pretty good. The full-time rate was $28 for an RN full-time. The per diem rate was $45. So why would I sign up for the full-time again? Not really sure. So once I really realized the per diem rate and working with agencies and realizing like, oh, I can make so much more money, or I can make what I was making as a travel nurse in my own city and not have to be worried about leaving my house for 3 months, or just, you know, the back and forth and the, am I going to find a job? Am I not? Like, all that is like, I'm done. I'm not stressed about any of that anymore. I'm not, you know, sitting in front of a computer doing 40 competencies to go into an assignment for the next 3 months. Like, that part of my life is over. So per diem nurses just make a lot of money. They can make anywhere from $10 to $15 extra on whatever the full-time RN is making. Peace of mind is my favorite. Like, I just love I have peace of mind now. Like, I don't, you know, one of my first staff ER job, we used to do self-scheduling. And although at the time I thought it was great, it was stressful. I'm like, I don't know what I'm going to be doing 6 weeks from now. I have no idea. But yeah, and so I have to put in this schedule that says, You know, even though it's tentative, they were pretty good at giving you what you want. So now if you put yourself on for a day that you thought you were going to be available and something comes up, well, sorry, you can't go. Sorry, you had to make your schedule 6 weeks in advance, and now you have nobody to switch with you. Or we're so short-staffed, there is nobody to switch with you. So, me not having to worry about my schedule is amazing. There is work out there. Don't let people tell you there's not work out there. There is work. If you ever met a broke nurse, it's because she's lazy. So, more on the schedule. As me doing this per diem work, I'm not working weekends. I'm not working holidays unless I want to. There are jobs out there that have minimal requirements. One of my agency's requirement, and I've worked for this agency even before I started traveling, was 1 shift every 6 months. It's so easy for me to keep. So, I have another one where they want you to do a major and a minor holiday, and you have to do X amount of weekend shift time on the weekends. Well, that's how it was introduced to me, but then I started working and talking to people. They don't implement that because they're so short. They'll take what they can get, and they're not going to let anybody go because they're already short. So that's pretty much that. PTO never gets denied. Time off never gets denied because you just schedule around the days you want. If I am going to take a week off, I'll take a week off. I'll bust my butt the week before and work a couple extra shifts to cover the money that I should be bringing in for that week, and I'm good. I don't have to worry about sick time, paid time off. Like, just make sure, number one thing is make sure you have money in the bank. Like, just make sure you have money saved. And I'll get into the how part in a second. But I don't have to put in a request. I don't have to worry about, am I going to get approved because all 4 nurses want it off on 4th of July weekend? Or, they all want it off the day before after a holiday, and I'm not going to get it because I'm bottom of the totem pole. But I don't have to worry about that. No politics, no requests, no meetings. I had a job, I worked today somewhere where everybody was pissed off because they had a lunch meeting. I said, first of all, we don't normally get lunch in the ER, so I'm just happy to get lunch. Secondly, I don't have to attend this meeting because I'm a per diem staff member. See you at 1. So that's that. What else? Oh, so that's pretty much the whys. I feel like there's more. If you guys have questions, please ask me questions. Because I'm pretty much just going off based off of my personal experience. There's probably a nurse out there, ER nurse out there that's been out there for 25 years and absolutely loves it. That's good for you. It's not for me. So the how. So first things first is while I was working in the ER, oh my God, my posture is terrible. Sorry, I also have self-diagnosed ADD. So first things first, I started working for a agency while I was full-time in the ER. The agency that I work for out here has contracts with other hospitals, schools, outpatient centers. So it was a great opportunity for me, and they loved ER nurses because we have all our certs. It was a great opportunity for me. I got to work in a school. I realized that ain't for me. I don't want to make ice packs 8 hours a day. I don't want my hands to be tied because mom didn't fill out the form that little Billy can have Motrin for his headache. That wasn't my world. It was too slow. So I tried school nursing. I've done telephone triage with rheumatology, with infectious disease. I've done PEM fertility on the PACU side. I've done maternal fetal medicine where I'm doing non-stress tests. These are all things where they gave me an orientation for a day or 4 hours, and then they just threw me in there and I was able to ask questions. But I've been able to learn so much without having to go into any of these specialties full time. I don't know how it is in other states and cities, but in Philadelphia, you have to have some type of school nurse certificate. I didn't need any of that. The agency just put me in there. I oriented for 8 hours and I was done. Now I have it on my resume. I've done school nursing. So it definitely, opened up my eyes, gave me tons of experience. If you can find an agency like that where they staff all over the place, go for it, because they'll just throw you in there. There's been places that they've placed me where I'm like, absolutely not. I'm not going back there. That is not for me. And I tell the director or the recruiter, hey, that's not a good fit. I'll pick up 1 or 2 shifts. I try it out. I like it or I don't. It is what it is. Again, the freedom of being per diem and the freedom of belonging to an agency like that is that they have to keep these contracts. So they are not going to put you somewhere where you're unhappy and risk them losing that contract. Again, another benefit to working for these agencies per diem. They have to keep the contract. So if the rate is normally $30, let's say it's just $30 an hour, and they really have a need. They have no staff. The person called out. They're really gonna need somebody for tomorrow. She can call me tonight. It is 6:46. So she could potentially call me at 7 o'clock and say, Mel, I really need you to go to this place tomorrow. You know, they're hurt and they need it. Okay. How much is the rate? 30. No, I can't. I don't know. We could do 35. I don't know. You know, I got to drive into the city. I have to pay for parking. I'm not sure. All right, we'll give you the $45 bonus rate. All right, for $45 an hour, I'll be there. What time do you want me to be there? So, I'm not sure if you can negotiate with every agency, but with my agency, you can absolutely negotiate, especially if they call you, they call you last minute, B, you build up a rapport with them, and they know that wherever you go, you're liked. I have not to toot my own horn, but I have an excellent rapport with every facility that I've worked for. So it's to the point where if I don't want to work, she's literally like begging me, like, hey, this office is asking for you personally. Is there any way you can help them out? And then at that point, again, I can negotiate. I've built up a rapport with these offices. I've talked to the manager. I've talked to the other staff members. They've gotten to know me. I've gotten to know them. We like each other. They literally will ask for you by name, like, hey, can you get that agency nurse, whatever, Melanie, whatever. And next thing you know, my phone's ringing. So again, there's always work. Number 2, this is very important. Don't go quitting y'all jobs if you don't have no money in the bank. So I started travel nursing for multiple reasons. You can refer to my first video about that. But I started travel nursing. I cleared up a lot of debt with my first assignment. Like my first assignment was just like catch up on bills, do everything I gotta do. And I was still able to do that while paying like 2 rents. I mean, it was definitely good money. My second assignment was a local assignment. So although the rate was higher, which was actually closer to my per diem rate now, the money wasn't as good as my first assignment. But again, I cleared so much debt that I didn't really need to make that much money. So I was okay with it. And again, it was a local assignment, so I was able to come home every day, blah, blah, blah. But I say all that to say, get yourself, if you're going to travel and you want to travel with the hopes of being able to take some time off after to do something else, you can absolutely do that. The last assignment that I worked was crisis pay. I was clearing good money to the point where like that was really what made my decision that I don't have to go back full time. I can put this money away, put it in the bank, make sure, I know what number I need. If I need, X amount of dollars every month just to pay the bills, and no matter what, I have to minimally work those amount of hours to make that kind of money. So if I need to work 40 hours in a month to make $1,000 a month to cover my bills, then that's all I have to work in order to pay what I have to pay. Do I have extra money for free stuff? No, I don't. Not if I'm doing it that way. But I was able to make my money, pay off my debt. Before I even saved $1, I paid everything off first. Second, I got all my numbers together. All right, how much are my bills? How much do I need to work to pay these bills? Will I be able to afford to work per diem if I, don't work for 2 weeks or, it dries up, whatever the case is? Yes, because that money that's in the savings account is not to be touched because I want a new pair of shoes. Although tempting, I don't do it. That money is for in the event that there's no work. In the event that I get fired, something terrible happens, I get sick, I can't work, whatever the case is, that money is there to cover those bills. So, most people tell you need 3 to 6 month emergency fund. I made sure that I had at least 3 months, and then I've been adding to it since then. So stack your money, get your numbers together, stack your money, and get a per diem job, and you'll be able to do it. I'm telling you, you can do it. Insurance. Number 1 question I get is, well, what do you do for insurance? First of all, settle. I'm currently covered with my travel agency. even though I'm not going back traveling. And I did make that very clear to my recruiter, but you know, she still reaches out to me and said, well, if you need to take an assignment, please, you know, give me a call. So currently my travel agency still covers me, and I'm probably going to lose, what's this, February now? I'm probably going to lose coverage very, very quickly, very soon. And plan B is I'm eloping very soon, so I'm just going to hop on my future husband's insurance. So that's an option. And then, you know, you have Cobra, which is very, very expensive. Just a heads up. I believe the marketplace is still available. The prices aren't as good as they were in the past, but those, you know, again, that's still available. If you're 26 and under, when I was 26 and under, my mom covered me. I let her cover me all the way up until they kicked me off of the insurance. So if you're watching this right now and you're a new nurse, or, you know, you're a seasoned nurse because you went right out of college or whatever the case is, you have some time to get out there and see what's out there and take the risk of learning something new and exposing yourself to something new and still be covered under mom or dad's insurance. What else on how? So I told you guys about working for an agency, travel nursing. Oh, also the last thing I did, and I just recently did this, was I got a per diem job at one of my local emergency rooms, and the purpose of that was to keep my skills up, because I have not worked in any ER since November. Since my travel assignment ended, I have not stepped foot in an ER up until, so from the very first week of November, because my assignment ended November 2nd or November 1st. So from the first week of November up until the last week of January, I did not step foot in an ER. So I knew I had to get in there. I knew I had to apply and get my skills up, because everything that I was doing was working outpatient and, you know, doing odd jobs. I've been also helping somebody start a home health business, and I've just kind of been working from home, helping that person do that. So they just pay me weekly. Oh, I didn't write that down. Weekly pay. As a travel nurse, you will get weekly pay. Most of these agencies, if not weekly, daily pay. So a perfect example, my cousin lives in Florida. She works for an agency that pays out every Monday, Wednesday, Friday. So if you work the day of or the day before, you're getting paid either Monday, Wednesday, Friday. Like, where else are you going to be able, what other profession can you do that? What other profession can you find a job that does stuff like that? I was hype about the weekly pay, and then she shut my dreams down with her daily pay. But I get a check every week. Aside from the hospital pays every 2 weeks, but I get a check every week from my agency as long as I work. So, again, back to the, you know, I told you I got ADD. So, again, back to the per diem job in the ER. To keep my skills up, I'm like, I haven't put an IV in anybody in God knows how long. So, you know, keep my skills, my assessment skills up, my certs. I've never had to pay for, you know, BLS, ACLS, or PALS out of pocket. When I started looking up those prices, it would have cost me very close to $1,000 to register for all these classes and pay for all these classes myself. So I was like, let me get to the hospital and let them pay for it. Conveniently, my ACLS and PALS are expiring in April, so they'll be paying for that. And then my BLS expires in December, so they'll also be paying for that. So the perks of working for a hospital, you know, even though you're per diem, you still get all the hospital perks. You still get, well, the one that I work for actually does offer insurance. That was news to me. I didn't realize that some hospitals have a per diem insurance option. Obviously, it's going to be minimal coverage. For them, they pretty much cover like 90%, 90 to 100% as long as I use their health system. That's fine by me. I can do that. But then you're locked in. That means you have to work a certain amount of hours during that 2-week pay period so that they can deduct your insurance, or you're going to be in a negative, and you do not want to go down that road. At this point, I'm just kind of like, I don't want to go anywhere where I have to be there for any amount of reason aside from the fact that I want to be there, if that makes any sense. But yeah, that's pretty much it. This is a long video, Lord. I felt like I'd cut out most of the fluff. But, you know, you'll see my illegal nursing nails. This is chipped, clearly. But I can't have nails like this if I work in the hospital full time. Hello? But that's pretty much it. So hopefully I didn't babble too much. Hopefully I didn't say too much. If you guys have any questions, please ask me questions. I love people when people ask me questions, because other than that, I won't have anything to talk about, and you'll get your next video in 8 months. But that's it. 25 minutes already. All right, let me get my life together. Bye. Welcome.